Introducing C-Armor, the surgical drape designed to maintain sterility of the surgical field during lateral or horizontal fluoroscopic imaging. The C-arm X-ray tube breaches the sterile field boundary during a surgical case, rising from beneath the surgical table to a lateral position adjacent to the patient's surgical site. The Association of Perioperative Registered Nurses defines the sterile field boundary as the horizontal plane at the level of the waist or the surgical tabletop. The current unstandardized, inefficient, and wasteful draping techniques fail to achieve the guidelines of five-sided protection. Current methods include covering the C-arm with half sheets, U-drapes, Mayo stand covers, and other drapes that were not designed for this purpose. These methods breach the sterile field in several ways. Drapes fall below the sterile field line and are reused. Gaps occur in the sterile barrier. Surgeon and scrub technician contamination occur frequently. Focus is diverted away from the patient. Time is wasted during surgery at an average cost of $40 to $60 per minute, and materials are wasted from repeated draping. These problems create excessive red bag waste, increased room activity, and an increased risk for surgical site infection. There are approximately 500,000 surgical site infections per year, and 20% can be traced to contamination during surgery. A single surgical site infection can cost an institution up to $33,000, and Medicare, CMS, will not reimburse hospitals for certain hospital-acquired infections. The C-arm is utilized for both lateral and vertical plane fluoroscopic imaging in many surgical disciplines, including orthopedic and spine surgery, interventional radiology, and vascular procedures. C-Armor is a patented expandable and collapsible sterile pouch which adheres to the existing drapes at or above the level of the sterile field line using familiar adhesive tape. It lies flat to the surgical field, providing unencumbered access to the surgical site. When lateral plane imaging is desired, fasteners supporting the sterile pouch are detached, and the pouch is expanded to accept the X-ray tube. This process requires approximately 3 seconds. Once deployed, the drape provides five-sided protection and maintains its position at or above the sterile field line. When the C-arm is rotated back to the vertical orientation, the drape is returned to its original collapsed position. This technique can be repeated as needed throughout a procedure. C-Armor can also act as a sterile pouch for the suction tubing and is clear, which allows visualization of the beam emitter for more accurate fluoroscopy and reduced radiation exposure. C-Armor is simplistic in design, essential in purpose, and cost-effective. The benefits of using C-Armor include reducing waste, eliminating costly time delays, and decreasing the risk of surgical site infection by reducing operative time, reducing room activity, preventing sterile field breach and OR team contamination, and reducing unnecessary institutional liability created by deviating from the standard of care. Now that there's a solution available, make the decision to treat your patients with the same standard of care that you'd expect for yourself or a loved one. Defend the sterile field with C-Armor. For more information or to order C-Armor, please visit c-armor.com.